Aloha, my name is Hope Young and I'm the Advanced Care Planning Coordinator with Kokua. My guess is that you found your way to this video because you're interested in palliative care, perhaps for yourself or for a loved one, or maybe you're just curious to learn more. For whatever reason you're here, welcome. Palliative care is specialized medical care for people living with a serious illness. This type of care is focused on providing relief from the symptoms and the stress of the illness. The goal is to improve the quality of life for both the patient and the family. Palliative care is provided by a specially trained team of doctors, nurses, and other specialists who work together with a patient's other doctors to provide an extra layer of support. Palliative care is based on the needs of the patient and not on a patient's prognosis. This care is appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment. Palliative care is care the way it should be. I'd like to share a story of my classmate and friend Johanna and her experience using palliative care. Johanna was rather reluctant to seek out palliative care, but after hearing more about it, she decided to see if palliative care was right for her. This is her story. Aloha, my name is Johanna, and I have metastatic stage 4 breast cancer. I was eligible for palliative care support services, and I enrolled with Kokua Care in December of 2019. My nurse came to see me every Friday. I also had a social worker who was able to direct me to the Department of Human Services to obtain emergency EBT SNAP benefits for the months I was out of work. My social worker was also able to work with my landlord and directed me to Hope Services, who helped pay for my rent. I also had a spiritual counselor who came by whenever I requested. I discharged myself from supportive care on January 2020. I do know that the team will be ready and willing should I need their help again. I would highly recommend palliative care services and support. My team was extremely easygoing on top of every issue that worried and upset me. Supportive on all levels, physically, socially, and psychologically. And they went above and beyond to be sure that I knew they were only a phone call away. It's true. I would pick up the phone to call my nurse regarding the side effects from my chemotherapy treatment that I was on, and within an hour or less, I had medication waiting to be picked up at the pharmacy for nausea and dizziness. They helped me with pain management, and they treated me as if I were a high priority patient. For that, I am truly thankful. Mahalo.